first question was that could you tell me something about your hardships, like while growing up at school, then in home, and even in college? Because I've realized that after like doing some research, I realized in schools and everything, like for children with type 1 diabetes, it's quite hard. Like for example, the PE sessions or even the juice breaks and lunch break, and they're not allowed, like especially type 2, even type 2 diabetes, they're not allowed to like take mid exam like snacks and everything. So that's quite a problem, especially in India. So what were your hardships which you faced at school and even at college?
Diagnosed with diabetes,
Yeah.
which was in 10th standard. So I had almost finished my so-called schooling.
Right.
But if I had to recollect my 10th standard, yeah, it was difficult on two accounts. One, lack of awareness that I could be suffering from something like this. So
Right.
I almost spent about 8 to 9 months before the diagnosis was made. It was, looking back, it was primarily my fault because I never told at home that I was having these problems.
So
Uh,
what were the
First,
problems you faced? Like,
yeah, if you have to correlate this to schooling, I used to go to loo once in between during the lunch break. But slowly I started going in the snack break and after one period and so on and so forth. And it became so difficult to even pay my attention to listen to the class because all that I wanted to do was go to loo. That is one of the symptoms, polyuria, increased urination. So I had to go to loo to pass urine every now and then, which slowly, if I can, this was 30 years ago, to be honest. So every now and then I had to rush to bathroom. And obviously teachers were distracted. No, I was just hungry. I was passing urine. I was drinking water. We did not know why. And uh, there were other things which would take us to doctor, like some ear infection. Something that my parents noticed was weight loss. It was on January 9th that I was diagnosed, January 9th, 1994, that I was diagnosed with type 1, admitted to hospital with diabetic ketoacidosis, which is a life-threatening condition where sugars are very high and ketones are present in the blood. And
so do you think that if there was screening, if there was a screening process like for diabetes in children done in school, like it would help people like you, for example, they wouldn't get to know before if they had diabetes. Do you think that's an
yes,
important fact?
so my teachers were worried about my weight loss.
Hmm.
But unfortunately, due to lack of awareness, they also felt that it was because I was taking a lot of stress, focusing on getting good marks. So they were like, "Why are you losing weight? Maybe you should go to a doctor." Is what one of the teachers told me. But as it happened, nobody thought of diabetes in that young age. And in fact, when the doctor told my parents that I was a diabetic, they were taken aback. They were shocked and they felt that how can it happen to such a young girl.
Were to have diabetes, I think the medical center would figure it out and they would have the awareness. Like you told me, there was a lack of awareness when you were in school. So it does affect your academics having diabetes as a child. So it was also a mental health, it was also like affecting your mental like outlook on life after your diagnosis.
No, I think my support system at home was really good.
Okay.
My parents, my mother especially, she's a very supportive mother, and I don't think they let it, like it was my battle, but they were fighting it. Hospital with a blood sugar more than 400, and this guy wants me to read it. But I did read, and I remember the sentence that I read also. And so the supportive family which wanted me to, especially my brother, I think what I would like to tell you is it was my brother's push. He wanted me to be practical about it. He told me that I am there, so you don't have to worry and you just need to do whatever needs to be done. So when I came back from hospital also, it was he who used to give me the injections
Mm.
before leaving for his college. So, and I think that helped me be very practical about it. And I think survival is something that makes you strong. I don't know how others have taken it, but I thought of this whole process as a fight of survival. And I prepared myself for it.
That's honestly a really beautiful story. Actually, it's really nice to have a supportive family, I feel like. And you told me about your brother. It just reminds me a lot of my brother too.
Mm.
He's really
Yeah,
supportive.
especially elder brothers.
Yeah, elder brothers. I agree. Yeah.
And I think he was the one who motivated me that I should take up medicine. My first year PUC went in that sulking mode. Um, I was not really pushing myself to do academically well. I did not have aims or goals because I thought, okay, I've been diagnosed with some big medical illness. So
Yeah.
I'm trying to adjust to that. So I need not do really much about everything else. And so I entered my second PUC also like that. There were two of my friends who were closer to my house, and we used to travel together to college. And they knew that I am a type 1 diabetic. So they were the support system in the college. So if I ever felt low sugar, they would be around to help me out.
Mm.
So because my doctor had told me that I need to tell it in the college that I'm a diabetic, and those two girls, my friends who are still now my friends, I had told them that I'm a diabetic, and they were ready. They were ready in the sense when we used to be always together in the classrooms. We used to sit in the same bench, and so anything, any problem, I would tell them, and they would be around to help me. We joined tuitions. We started studying for the exam, but there was no goal. So
Mm.
one day, my brother called me again to his room and asked, "How is your preparation going on?" I said, okay, today, if you don't do well in your second PUC exam, people will sympathize with you because they'll think, oh, she had diabetes. So there was a lot of problem. But after 10 years, none of those sympathizers will be there with you.
Yeah, that's
It's
so
you
true.
and your failure. Um, so don't let yourself fail. You're not just this. You're capable
You're
of
not
much
just your
more.
condition. Yeah.
Yeah. And I think that conversation that I had with him that day, I started preparing more aggressively. And in second PUC, I got 96%, and in the state ranking of medical 171, all thanks to my brother.
It's so beautiful how you didn't just let your condition define you, and it's really inspiring to me also because I'm a student in 10th grade, and
Yeah.
hearing about all of this is really motivating me also. So thanks a lot for that story.
There were several points in my journey where my brother was helpful. I CET ranking 171, so I got a seat, medicine seat, free medicine seat in any college in.
So my next question is, you must have come across other children or students with type 1 diabetes. Has the disease affected their studies or their growth in life? Like how you said it, you didn't let it define you. Would you think that they have a similar outlook like you on life? Like did they let the condition affect them?
That's a small number, actually. I don't know why. The people around me were non-diabetics, and I did not get to meet many people socially. Uh, People with type 1 diabetes. A few acquaintances that I had in my workplace, I had a colleague who was type 1 diabetic, and she was very comfortably adjusted because,
Right.
again, the most important factor here was the family support. I see a lot of people who are well adjusted to their diagnosis and have moved on with life, doing what they wanted to do
Right.
because of the support system they got. On the other hand, the children with diabetes that I see in my workplace, which is a government institute,
Mhm.
mostly have problem because of their socio-economic status.
Of course, because even the costs of the insulin pumps, like it's pretty much a lot for those people, and even like especially for students, I heard that Tamil Nadu was the only state which completely sponsored like the insulin pumps to their children in schools. Do you think that if Karnataka made a move, like for example, sponsoring the insulin, it would be really helpful for the children?
Absolutely. Insulin is life saving. And
Yeah,
for people with type 1 diabetes in childhood, they shouldn't have to, ask or beg or plead with somebody for insulin.
yeah.
And I think, especially when I look back at the children whom I have interacted with, they
Mm.
are all, come from lower middle class or very poor strata of people, and they have absolute no access to insulin.
Yeah, of course.
And probably when you look at their parents' priorities, they are hand to mouth. So with a salary that might just be enough to have their food and a decent
Yeah,
living, to spend another 4-5 thousand per month for insulin is very difficult for them. And in fact, our institute is one of the few institute where free insulin is provided for children up to 18 years. See,
yeah,
most of the children with diabetes are dependent on such organizations. Earlier, I had told you about Dr. Prasanna Kumar. He had this trust called EDRT, where they used to provide free insulin, free tests, and other stuff for children with diabetes.
yeah.
And then he had a collaboration with Novo Nordics or Biocon, where they used to provide free insulin. Same holds good for our institute, where free insulin is provided for children with diabetes up to 18 years.
So, another question, like a follow-up question, does having type 1 diabetes affect day-to-day functioning of an individual, or are there any experiences of yours in which you felt dejected or sort of sad because of this condition?
Living with diabetes is like a 24 bar 7 job. It requires a lot of efforts. And somehow I've been trained to do that we see on a daily basis.
Of
They
course.
have difficulty procuring insulin.
Yeah.
So there's no way that, they could have done anything else. I think the most important factor here is acceptance.
Yeah.
Most of the children with diabetes go through problems because of uh, poor acceptance on their part that this is their life. When you set your goals in such a way that your blood sugars are under control, you know how to handle highs and lows, then it shouldn't come in the way of your normal life.
So, like with the insulin pumps constantly like having to be taken by the students, like by the people who are affected by diabetes, what problems do you think it would pose to students who are studying in school, like having to constantly take the insulin pumps? Like you told me that um, it wasn't a huge problem for you because you had a great support system. But what do you think would be the challenges students would face now? Like, were you allowed to take insulin pumps during your college and in your school too?
I was under a very primitive insulin therapy. There was no pump. Even now, I'm not on pump. I
Right.
take multiple injections daily. Um, if you look at the requirement of insulin injections or pumps in the colleges, again, as I told you, it's all in the patient's mind, it's all in the student's mind, whether I'm accept. Many children with diabetes find refuse to take insulin in the afternoon, saying that how can I take it in front of my friends. Most of the children refuse to take insulin in the afternoon. See, in a type 1 diabetes is insulin deficiency state, so there are different ways of taking insulin. And one is pump. Pump is the ultimate way of taking it, where
Yeah.
there is continuous infusion of insulin. And also, whenever you're eating food, you can just press the button to let the bolus go in. So
Yeah.
insulin pump requires a small machine gadget stuck to your body. Along with that, there is one small tubing going inside, which can deliver the insulin.
Yeah.
This gadget being present is a very easy way of doing it. It shouldn't come in the way of attending college or any other activities that you could do,
Of course.
because these pumps are now even can be used when you're swimming. So that shouldn't be a problem. So having a pump, it cannot come in the way of attending to any of your activities, whether academic or non extracurricular activities. On the other hand, when somebody is taking multiple injections per day, the way I am taking, I take insulin Tresiba at bedtime and 3 injections before my meals.
So, what do you think are the main improvements we could have in the teachers, for example, the sports teachers, in their awareness on, for example, type 1 diabetes? How could improvements be made in the school facilities to accommodate for these children?
I think first one is teacher awareness programs. Teachers are trained how to teach the students but teachers should also be trained to care for the students.
Yeah.
So can it become a part of their curriculum? Whenever there is a child with diabetes who has to attend to school, the teacher, school, and the medical care team of the child can interact at some point of time, where the doctors can provide some pamphlets or information brochures to the school, where at least this much should be done. The first thing is for the parent to inform the teachers and the school that the child is suffering from type 1 diabetes, and it requires these things to need to be done, like for example taking insulin, checking sugar, identifying low sugar. So
Yeah.
the parents should have a detailed conversation with the school regarding these requirements. Our institute was at one time involved in diabetes education program for schools. We did this in 2016, where we went to some schools and provided some educative material in handling the children with diabetes. And even the other organizations are also doing a similar activity.
Understand that every child has different unique qualities, and they should
Yes.
they should use that for teaching them.
Teachers should
Exactly,
be the
because
best paid and best trained people in our society.
they're basically paving the future path for all of
Yes,
India and all of the entire nation. Like,
absolutely.
so my next question, I think it's my last question too. Is there any major research that's happening in the field of diabetes which could give a ray of hope to children with type 1 diabetes currently?
The research has been ongoing for several years now, and there are several organizations like JDRF, Juvenile Diabetes Research Foundation, which have been funding a lot of such researches. So the research that is ongoing is to find out whether we can identify children at risk, whether we can halt that risk, whether we can identify children with early diabetes and reverse that process.
Okay.
So prevention and reversal are two things that are ongoing in the fields of type 1 diabetes. We are very far away from the goal, and probably it might take decades before we successfully cure type 1, because type 1 is a very complex disease, and the damage happens much more before we can identify. Hence, we are only doing the damage control. We are replacing. The insulin producing cells are gone. We are only giving insulin from outside.
Yeah.
So, can we regenerate those cells?
Like
Can
stem
we
cells?
replace those cells? That's a challenge.
So do you think there's a future for stem cells in the diabetes field?
If you ask me, this discussion has been going on since the time I've been doing my post graduation. Yes, stem cells have been holding a lot of promise, but also comes with a lot of controversies and challenges. And I'm not sure when we will see the day when it could be used confidently in a larger section of people.
It'll just be my last question. Um, can any Indian research organizations come out with a solution for these problems? Do you think there's some hope for the future?
The problem here is not a single strata. There are multiple stratas to it. So when you talk of children with diabetes, how do we change the life of children who are already having diabetes? How do we identify much more children in the early phase? And how do we prevent diabetes? So these are the questions that are multi-pronged and multifaceted. So there is no single answer for it. Now, if you look at it, it involves interaction of the people with diabetes, people caring for diabetes, and also the state, or rather administration, or whatever you might want to call it. So government involvement is a big requirement that should happen, and in fact, that will be something that should change. And if you look at children with diabetes, the numbers are very small when compared to people with type 2 diabetes, and they deserve the best care and best requirement if government could provide free insulin, free testing, free education, there's so many things that could be done. But can our government afford to do that? Can our government do that in a very transparent manner,
Yeah,
very
because I've
safe manner? That's the
been
question.
going on for a long time, like people advocating for free insulin and all, but it's not been happening because, yeah, there's the question that government, can they actually afford to do it?
Absolutely, because free insulin is something that children will require lifelong. When do you, how long can you provide it to one particular person? So that's a
So,
question.
Doctor, thanks a lot for the discussion. I won't hold you back for longer because obviously I know you're really busy. But thanks a lot for this entire discussion. It was really enlightening for me. And I was hoping like you would like to help us out in our plan, in our project, because Dr. Shastri is already helping me out, and even Dr. Giridhar. So if I need any help or any assistance, I would definitely like coming to you.
Sure. See, I think Dr. Shastri had sent me a message where he was talking about collecting data from
Yeah.
these children. See, in our hospital, we have divided into two sections. Ours is a government institute where most 90% of the patients that we see are diabetics.
Yeah.
And in this diabetics, we have divided our work between adult and pediatric.
Yeah.
And
So
same
we're
holds
doing
good for,
pediatric. We're focusing
yeah?
on pediatric.
Huh?
We're focusing on pediatrics.
Yes, that's why. So, the pediatric part, there is another team looking after the children with diabetes. So, also in Indira Gandhi Institute and Dr. Prasanna Kumar's team. So, if you want to connect to prepare any study or data, these three are the places that you should be looking for. In Indira Gandhi Institute, Dr. Vani and her team is doing an excellent job. And Dr. Prasanna Kumar, he is the first person who he is one of the most senior endocrinologists in Bangalore, and I worked under him, and they were the ones who initially began providing free insulin for children with diabetes in Bangalore, and he has the highest data on these children. He in fact came out about creating data on people with diabetes.
Could you like help me with the contacts of Dr. Prasanna Kumar and maybe
Dr.
the
Vani, and yeah, I forgot. In our hospital, it is Dr. Santosh and team. These three are the people you should be contacting if you want to connect to the children with diabetes.
Yeah, because right now we're still in the stage where we're trying to get approval from an ethics committee. So we have to still do that and then we can start like the entire process.
Yeah, that will be great, I think.
Yeah, and I think I would just love to like maybe even spend one day getting exposure to your job and how you exactly do things in your institute. Like I would love to like visit one day and just see how it's done.
Sure, why not?
Yeah, it's because it's really like a passion of mine, like public health, and I'd be so happy if I could just visit one day and just see how everything goes on.
Sure, why not? You're always welcome. Let us know when you want to come, and I'll introduce you to Dr. Santosh also.
I don't know if this is too personal to share, but the main reason I got inspired to work in the medical field is because my grandmom, she actually had non-alcoholic cirrhosis. So we never figured it out, but one day, like throughout my childhood, whenever I would visit, it would be like she's always unwell. So then one day I realized that, oh my god, she's always unwell, like by the time I was 12. And then I just started, she passed away like a few years ago. But that's how I started getting an inclination towards medicine.
Yes, I think medicine is a wonderful field. Apart from the stress, I think when you look around people around you and see that they have some particular issues and how that could have been solved with the earlier intervention. Morning till evening, I see that people with diabetes, and it's not just about managing blood sugars. There are so many challenges. So patients want to spend some time talking to their caregiver, and in a government system, when I see 40-50 patients in a day, I feel I'm not spending enough time with my patients.
Yeah.
In a Western country, a doctor sees 5 new patients and 10 review patients.
Yeah.
Here it's like an ocean. So how much time can you give to a particular patient? How much time can you hear to them? Possibly not much.
Yeah. Okay.
So we are very far away from that phase where the doctor-patient ratio could be altered, and our population is huge.
Yeah, population.
That's a bottom line. Our population is huge.
Yeah, doctor. So thanks a lot for the entire discussion. And I took it much longer, and I made you wait for longer. I'm so sorry.
No problem.
But yeah,
For me, probably this is the first time I'm spending so much of time talking about
yeah,
myself.
I'll definitely let you know, and I'll be in touch. And you could just help me out with the contacts from the
Sure,
institutes.
definitely.
Thank you. Yeah, so I'll just end the call.
Yeah,
Thanks,
all the
Sugar.
best for your project.
Thank you.